Does it strike you as odd that in a country as prosperous as America, the healthcare and food industries, two sectors deeply intertwined with our well-being, seem to be profit-driven more than health-driven? When we examine the healthcare industry, we see a system that operates on a fee-for-service model. Doctors and hospitals are paid based on the quantity of care they provide, not the quality. This system incentivizes providers to overprescribe treatments and tests, leading to a culture of overtreatment. The pharmaceutical industry, too, is not immune to profit motives. Critics argue that these motives can sometimes prioritize treatments that manage symptoms over cures that eradicate diseases. Now let's turn our gaze to the food industry. The prevalence of highly processed foods is not a mere coincidence. These foods are cheaper to produce and have a longer shelf life. They are also often loaded with sugar, salt, and fat to enhance taste and promote consumption. But what about regulation? In the healthcare sector, America differs from many other developed nations in its limited governmental oversight over pricing and practice. In the food industry, the government subsidizes crops like corn and soy, which are used in processed foods. This makes unhealthy food cheaper. Furthermore, regulation often falls short in mitigating the amount of sugar, salt, and fats in our food. Culture plays a part too. Both fast food and quick medical fixes align with a culture that values immediate results. And both sectors use aggressive advertising, often downplaying health risks, contributing to a landscape of misinformation. But there are speculative elements that could reshape these industries. Artificial intelligence could mine health data to develop targeted treatments. However, there's a risk it could be used to maximize profit instead of patient wellness. Blockchain technology could offer a counter-model, decentralizing control of medical records and food sourcing. Yet in the spirit of balanced discourse, it's worth noting some counterpoints. The profit motive has led to medical advancements and a wide variety of food choices. And the principle of consumer sovereignty suggests that adults can make informed choices, though this is a contentious point, given information asymmetry and the role of marketing. So, what could a high-quality change look like? In healthcare, investment in AI-driven diagnostic tools that prioritize long-term health outcomes could be a game-changer. In the food industry, adopting tech-enabled vertical farming and lab-grown meats could provide healthier and more sustainable options. In conclusion, it's not that these industries inherently aim to keep the population unhealthy. However, the incentive structures and regulatory environments do create conditions where less than ideal health outcomes are more likely. It's high time we critically examine and challenge these systems for the betterment of our collective health.